So atopic dermatitis is a chronic inflammatory disease that disproportionately affects patients of skin of color. These are patients where the disease itself may manifest differently. We typically see in these patients more extensive surface involvement, dyspigmentation, presentations of more papular and lichenified presentations. We also see, erythema, which is really the hallmark of atopic dermatitis, may be more difficult to appreciate in these patients. So oftentimes we underestimate their level of disease severity. Moreover, these patients of color oftentimes are underrepresented in clinical trials, in clinical textbooks. So often as physicians it's a challenge to really appropriately diagnose them and appropriately treat them. So Admirable was a unique study in the sense that it was we studied a patient population exclusively of skin of color. These were patients 12 and older with either moderate or severe atopic dermatitis. Skin of color was defined as non-white population with a Fitzpatrick phenotype of either 4, 5, or 6. And so these patients were treated with Lebrikizumab, which is an IL-13 blocker. And the way the study was designed, this was a phase 3 2B open label study where they received, all of them received Lebrikizumab at week 0 and week 2. They received loading dose of 500 milligrams, followed by 250 milligrams every 2 weeks for 16 weeks. And at that time point, those who were responders, we lowered their dose to 250 milligrams every 4 weeks for up to 24 weeks. And those who were deemed as non-responders, their dose was continued. So every 250 milligrams every 2 weeks. So in this trial, we had adults and adolescents. About 3/4 of these patients self-identified as African American or Black race. About 20% self-identified as either Latino or Hispanic ethnicity, and about 11% were Asians. And so so in this trial, at week 16, we saw that about 70% of patients, and these were all patients of skin of color, achieved the primary endpoint, which was 75% reduction of EASI score. And about half of these patients had completely clear or almost clear skin. So that was one of the endpoints. So those who achieved 75% reduction in their EASI score or had either an IG response of clear or completely clear skin, those are what we can consider responders. And those are the ones who then we lower the dose to 250 milligrams every 4 weeks. So in this trial, about 70% of these patients did respond by week 16. We also looked at patient-reported outcomes. So it's one thing, to have the investigator determine whether they respond or not, but the more important question is how do patients feel? So in this study, we used a tool called the Atopic Dermatitis Control Tool, which is really a patient-reported self-assessment, very easy, 6 questions. And at week 16, 64% of patients actually had what we consider good control of atopic dermatitis versus a baseline where only 12% had good control. More specifically, when we looked at these measures, we found that about 63% of patients by week 16 were not bothered, so either had little or no bother of their disease. About 69% had 2 or fewer days per week of little or no itch, and 83% of patients reported that they were not at all bothered emotionally or little bothered by their disease. So those are very good positive outcomes. Another aspect that we looked at was work productivity. So among those patients, 60 patients who were working, We looked at their reduction in work productivity, and we also looked at total impairment of activities, and there was about a 50% reduction in this population. So not only did they got better, but it improved their work productivity and their overall work productivity. So I think the conclusions here is that this is a unique study where we look exclusively at a population that typically is underrepresented in trials, and found that they did equally as well as what we found in the pivotal trials. And more specifically, it found that Lebrikizumab in this population of moderate to severe atopic dermatitis had a significant functional improvement in terms of outcomes, as well as improvement in quality of life. So I think these are important conclusions. Now, the limitation of this trial, it was at open label, there was no placebo control, and it was a relatively short duration. But that being said, I think these are still, we can glean important information from this study, and it challenges clinicians like myself to really think about these questions beyond just skin clearance, to think about some of these aspects of quality of life and work productivity and impairment quality of life.